So do you think it's inappropriate for patients to be asking about surgical movements at an initial consultation?
No, absolutely not. I think it's just not my practice, right? It's just not the kind of environment where I can discuss that or I can elaborate on exact movements and such. It's not, but I think it's totally appropriate for those that can and have the ability. They have to, right? Because again, that's just the nature of the beast right now.
Are you philosophically, do you find it in bad taste to do that? Do you think it's a corruption of the field that it's come to that? Do you consider that a regression or a corruption, that this is what patients are looking for?
No, I don't think so. I think it's just when patients take that idea and they, like I said, they believe that it reflects the broader clinical best practice. For example, I had a patient that really asked me, she asked me to treatment plan and just give her numbers because she really felt like psychologically it would help her. And so I had a CT scan anyway, and I sent it to my engineer and I gave her rough estimates. I didn't give her anything concrete. And I said, I think I would do this. And this was at a different appointment. And she told me, doctors told me he would rotate this many degrees. And she was very disappointed. And it was like, but this is the standard. This is how many degrees I was told that I was going to be counterclockwise rotated. And so part of me was like, if you were going to trust me as your surgeon, as somebody who has the knowledge and your best interest, this is what I believe I can do in my hands. For whatever reason, maybe I don't think your joints can handle this much rotation. Maybe I think aesthetically it would be too much. But for whatever reason, this is how I feel. This is my treatment plan. With all due respect, if you want that number, then you should go have the other doctor do your surgery. At some point, when patients feel like that is the holy grail and those are the numbers and it's absolute, yes, it does become a bit of a problem because we're all trying to do the best we can for patients. And there is a bit of an art form that there's an art form to what we do and how we do it. It's also like when people bring me treatment plans from other surgeons, or if they've already had jaw surgeries done with other surgeons, they'll bring me the treatment plan and they're looking for me to say something. It is an art form, and to criticize other people's art I don't see that.
Right. But at the same time, there are good surgeries and bad surgeries. Every surgeon is qualified and has the credentials, and every surgeon expects their patient to trust them. But should jaw surgeons be trusted by default because there's just so much? And maybe this is an artifact too of the social media era of jaw surgery. There's this sense that the default surgery is a kind of a botch or is mediocre or worse. And so patients are trying to find that right answer of what is the right amount of rotation or advancement or segmental or not. So how do you balance wanting to navigate what is really a minefield? And maybe you disagree that it is a minefield. How do you navigate that with just trusting the surgeon?
It's a great question. It's really a philosophical question. This is, at the end of the day, it is a medically necessary surgery, but it's an elective surgery. You're electing to do this to improve your quality of life, your airway, your aesthetics, your proportions. And that is a difficult philosophical question to answer. I think most orthognathic surgeons that do a lot of surgery are pretty good. Most people are searching for somebody, I think, one that they trust and one that they vibe with. You walk in, you're perhaps somebody that's looking for a certain type of surgeon. They can walk in, and I usually wear like exercise clothes to work, and I walk in and they might just not vibe with me. So you have to trust your surgeon. You have to vibe with your surgeon, but also you have to be able to communicate and be able to feel comfortable to communicate these things. But Do I necessarily let patients come and do the treatment planning with me? I don't, because no, I have a way of doing things where this is the way that works for me. I like to do my treatment plan with my engineer where the two of us just bounce ideas and talk and look at different types of movements. And it may not be the best for patients to come into that process. That's what works best for me. Right. But am I communicating each aspect, risks, benefits? If I do this, maybe every aspect of what we try to do, we try to balance aesthetics with function. But how do you go? See, I'm rambling on again. See, how do you really trust a surgeon? That's why I said there's a lot of positives that come out of social media and platforms such as this. And there's a lot of support, and there's a lot of patients that do have the kind of knowledge that they didn't have before. You're right. But there's got to be a balance where you at some point just have to trust your surgeon to do what's best for you.